Overall survival is defined in clinical trial as the time from randomization to death for any cause. Sometimes we look for breast cancer specific survival, that is survival from randomization to death for breast cancer. But if we're talking about advanced breast cancer, the majority of the deaths are related to breast cancer, and usually these differences are not applied. For two main reasons. The first is an objective measure of the outcome. Compared to progression-free survival that require a definition of progression, overall survival is an objective measurement because death cannot be misinterpreted and so it's considered a clean outcome. But there is also a more important reason that overall survival and quality of life are considered the most important goal in treating cancer patients. So for this reason, overall survival is considered by many the gold standard endpoint for clinical trials. There are two major trials that have studied the activity of eribulin in advanced breast cancer. One is the EMBRACE that tests the use of the drug in heavily pretreated breast cancer compared to treatment physician choice. These trials show an increase of response rate, progression-free survival by investigator review, with a small benefit of still by the central assessment, and an overall survival that was clinically significant and meaningful. The other trial is the 301, comparing eribulin to capecitabine. And so at the end there are two independent trials in two slightly different settings. In the past, we have a few options of treatment for treating metastatic breast cancer. And metastatic breast cancer was considered a not curable disease, and this setting was defined a palliative setting. This means a cultural aspect in which we didn't really expect to use the drug to improve overall survival, but more relieve the symptom of disease. And quality of life was in some way the main goal of treatment in this setting. But now we have many options available for treating metastatic breast cancer, different according to the molecular subtypes, that have shown that not only can relieve the symptom of disease, but in particular case can also impact overall survival. This makes a huge change in the interpretation and the goal that we should achieve in this setting of disease. The first big advantage and improvement that we have seen the last 20 years is to recognize that breast cancer is not a unique disease. According to this notion, we now recognize that according to the subgroup of disease, we have a targeted therapy that can be useful to improve the outcome of the patient.